Welcome to this presentation about nutrition after bariatric surgery. You should have already watched the webinar presentation on nutrition before bariatric surgery. It's important to understand when, how much, and what to eat. Welcome to this presentation about nutrition after bariatric surgery. You should have already watched the webinar presentation on nutrition before bariatric surgery. It's important to understand when, how much, and what to eat following surgery so that you are safe after the surgery and that you get the best results. The surgery is not magic. It's a tool to help with weight loss, but not a solution. You have to be aware of what you eat for it to be successful. There are three main kinds of surgery that are undertaken within our service. The gastric bypass involves creating a small pouch at the top of your stomach and realigning the small intestine so that the stomach contents empty further down and the main part of the stomach is bypassed, and that's where it gets its name from. The 1 anastomosis gastric bypass is a newer version of the traditional gastric bypass. It is similar in that food bypasses a large portion of the stomach and a portion of the small intestine. However, this surgery has only one joint or anastomosis instead of two. The other type of surgery is the sleeve gastrectomy, where a portion of the stomach is removed, and that long, skinny-looking stomach is left and is much smaller than the normal stomach. All surgeries work by making your stomach much smaller. Paying close attention will make you feel full with much smaller food portions, so it makes it easier to eat less than in the past. You can easily ignore fullness, especially if you are in the habit of eating when you are not really hungry. Let's now talk about some of the things to identify before surgery. There are two main ones to do with eating. The first is what we call non-hungry eating. Non-hungry eating is eating when you think you're hungry, but you really are not hungry, or eating past the point of being just full. The second problem can be non-mindful eating, which means not being mindful about how much and what you're eating, so you're not in the moment. This could look like eating without being aware of how much you are taking in, eating quickly and not enjoying the meal or snack because you're in a rush or eating on the run, eating when there are distractions like watching TV or using your mobile phone while eating, responding to emails, sitting at the computer. We know that people tend to eat a lot more in these situations as the eating is not mindful or done with awareness. These can lead to eating past the point of being full and overeating. So non-mindful eating is eating that doesn't relate to hunger or fullness. So what reasons might people eat besides being hungry? There are many reasons. See if you can recognize if any of these relate to your way of eating. The availability of food, what is in the house, what others buy, your budget, the sight or smell of food around you, and what you prefer to eat. The environment that you are in has an impact on eating. It might be your workplace, your social environment, what the weather is like, your culture or religious beliefs. Marketing and advertising can impact on your choices and eating. You might see an ad for a fast food chain and then feel like eating that meal. The placement of foods and products at the shops or the petrol station and celebrations. Emotions can be negative and positive, such as happiness, sadness, anger, stress, and habits, like having a couple of biscuits with your tea or coffee. It might also be boredom, a common reason for eating without hunger. So changing non-hungry eating can be challenging. The first step is recognizing that you're doing it and identifying your triggers. Once you know this, you can start making a conscious change to deal with those triggers differently. One thing you can do is to try to replace eating with something else. And this is something that you need to practice many times. It doesn't need to be perfect, but practicing doing something else instead of eating is an essential step to changing non-hungry eating. You can come up with a list of things you can do instead of eating when you know you aren't hungry, but here are some ideas that might work. The list is certainly not exhaustive, but includes walking, reading a book, ringing a friend, or meditating. It's important to think of what works for you when you start feeling the trigger to eat, but you know you're not hungry. Keep practicing, and you'll learn to listen to your hunger more and manage non-hungry eating. It doesn't need to be perfect, but Giving it a go is a crucial step to help you once you have your surgery for it to be successful. It is essential to practice eating mindfully before surgery. Try some of these tips to help with this process. Before your surgery, consider your relationship with food. If you need to, work on changing it with your goal to eat mostly for hunger and stop eating before you feel full rather than overfull, and eat more mindfully. Practicing eating mindfully using some of those tips. A dietitian or psychologist may be able to help you further if you feel you need some more support. Now let's talk through what to eat after surgery while in the hospital. On day 1, you will be allowed to start on a clear fluids diet of water, broth, diet jelly, apple juice, black tea or coffee, taking only small sips regularly, and if no problems, you will progress to what we call full fluids on day 2. You can only take up to half a cup slowly of things, such as low-fat milk, custard, yogurt, smooth soups or porridge. On day 3, you will progress to a smooth puree diet with 2 tablespoons at a time. You will, of course, have visits from the dietitian while in the hospital, allowing you to ask questions about the diet when you go home, so you are as well prepared as possible. You must not have any fizzy drinks or sugary drinks. You must separate your food and fluids and eat and drink very slowly. Once you go home from the hospital, there are 3 stages to the diet. Stage 1 is the smooth, pure diet. Stage 2 is the soft diet, and stage 3 is based on healthy eating practices. Smooth pureed. This stage requires all food to be vitamized or blended to a smooth liquid consistency with no lumps to prevent blockages and protect your new, smaller stomach. This means you will need a blender or food processor if you don't already have one, and you will need to add extra water if you need to for a smooth consistency. You can start making up some vitamized foods and freeze them in small containers or large ice cube trays. You will stay on smooth puree for about 4 weeks after your surgery. There are recommendations in the smooth pureed phase for how much you should eat, which must be followed carefully. It consists of 3 very small meals of 2 tablespoons, up to a 1/3 of a cup. Make sure you avoid fluids 20 minutes before and after your meals. To ensure you get enough protein, include some high-protein drinks, milkshakes, Optifast, sipped between those small meals. The second stage is the soft diet from about 4 weeks to weeks 6 to 8 after surgery. Again, this stage has quite specific recommendations to follow carefully. Food needs to be cooked until very soft, or already have a naturally soft texture. So, no crunchy or hard pieces are allowed. Again, 3 very small meals, now from 1/3 of a cup up to 1/2 a cup, are allowed. You can include high-protein drinks sipped between meals. It's essential you stop as soon as you feel just a little bit full and practice your mindful eating tips. The third stage, where you return to healthy eating around week 6 to 8. This is when you start taking more solid foods, still having 3 meals per day of around about 1/2 a cup per meal, depending on how full you feel and based on healthy meals and choices with good variety. The amounts you can tolerate will slowly increase over the next 6 to 9 months. So be mindful of this and keep quantities low. Tips for success. The first 12 months following the surgery are the best time for weight loss and for forming positive eating habits, being more mindful and eating with more awareness. Eating slowly, chewing your food very well, and stopping before you feel full is important. The quality of the foods you choose is crucial, as you won't be able to fit much in. So the foods need to be very nutritious or nutrient-dense. And choosing much less of the foods that don't have many nutrients but have quite a lot of calories or kilojoules is so essential to help with your weight loss goals and to make sure you remain healthy. Avoid low-nutrient choices such as chips and snacks, alcohol, juices, cheese and cakes. These need to be limited as much as possible as a lifelong habit. Focus on your fullness. Overeating can compromise the surgery and reduce your success. It's essential to use your fullness as a guide about when to stop eating, being in tune, and listening to your hunger and fullness for success. Stop eating just before you feel full. If you keep on overeating, you may end up vomiting. you will overstretch your new small stomach, and you will start to gain weight, thus sabotaging the surgery you have waited so long to have. Grazing can also create problems for you. This is why it's essential to follow the recommendations carefully regarding the amounts recommended and when to eat. If you graze throughout the day on food without really thinking about what you're doing, you can end up overeating, which will sabotage the surgery, and you will end up putting on weight. Sometimes, there are a few foods that people can't tolerate in the long term following their surgery. Usually, these are small in number, and they don't always present a big problem. Tough red meat is commonly tricky to tolerate long term, and sometimes bread. Even with these issues, you can manage to eat a healthy diet. Of course, socializing will be very different when you can only eat a very small amount. In particular, going to a restaurant may be a challenge, so being aware of the changes to your social life and eating out is essential to be prepared for. Physical activity, mindful eating, and multivitamin supplements must be part of your everyday routine. Your dietitian can help you with tips to manage these things, which is why regular appointments are necessary after surgery. Vitamins and minerals are essential after surgery. Buy these before you have the surgery, so you are prepared when you go home. A bariatric-specific multivitamin and mineral supplement, including calcium and vitamin D, will be required lifelong. For the first 3 or 4 weeks, all meds need to be liquid or able to be crushed for you to take them. Other vitamins and minerals might be needed depending on your blood tests, such as iron syrup or vitamin B12. An extensive list is provided in the resource. You will be given a follow-up appointment when you go home from the hospital to see our dietitian within 4 weeks. They will review your progress for the first 12 months, advise you when to go on to the next stage of the diet, provide you with specific nutrition and supplement information, and help you with any problems you might have. After 12 months, you will need to see your GP for ongoing yearly reviews with a private dietitian, which can be accessed through a GP management healthcare plan. In summary, bariatric surgery is not magic. It's a tool to help weight loss, but not a solution. Physical activity is crucial to maintain lifelong to help with weight loss and maintenance over time. Activity needs to be part of your daily life. You may need to change how you relate to food now before the surgery so that you do better and are more successful. You must follow the recommended foods and amounts after your surgery to be successful, to help you stay well and feel good and prevent any complications that can occur with surgery. Please make sure you take the time to review the related resources provided to you in more detail. These include your diet before surgery using a VLED and one of the other resources, nutrition advice following gastric sleeve or bypass surgery, depending on the surgery you are having. Thank you for listening to the presentation. We wish you well with your surgery.